What is ureteroscopy? Ureteroscopy is an endoscopic surgery of the upper urinary tract to remove stones that are stuck in the ureter or kidney, to evaluate the urinary tract for possible tumor, or to evaluate for obstruction or scar tissue of the upper urinary tract. It is usually performed with an ureteroscope that is passed through the urethra and into the bladder and then directly into the ureter. Usually this procedure is done to remove stones that are closer to the bladder than the kidney, but newer technology allows ureteroscopy to be used for stones in or near the kidney. This is a common outpatient procedure and works for most people, and can also be used for other conditions that are not necessarily kidney stones. Procedure. The approach for kidney stone treatment is to find and localize the stone using X-rays or CAT scans. Once we can determine where the stone is, we then go into the ureter with a very small rigid or small flexible scope called the ureteroscope. The goal is to approach the stone and then be able to do some form of manipulation in order to remove the stone and improve your symptoms. Smaller stones can typically be removed in one piece, but larger stones may need to be broken up. We can do this by using small laser fibers to break up the stone, which will make the stone crack and crumble into smaller fragments. In some instances, we use a small instrument with a basket so we can grasp the stone and pull it out of the urinary system if the surgeon feels safe to do so. Ureteroscopy may be more difficult or unsuccessful in patients with anatomy not conducive to scope manipulation. Conditions include very narrow urinary anatomy, stricture, scar tissue, or changes due to previous abdominal pelvic surgery, radiation therapy, or a very enlarged prostate in men. Side effects. Ureteroscopy is an outpatient procedure and patients are able to go home the same day. In some cases, a hospital stay may be required, but it is usually no more than 24 to 48 hours and only if signs of infection are noted. For several hours after the procedure, you may have a burning feeling when you urinate. This feeling should go away within a day or so. Drinking a lot of water can help reduce the burning. Your physician also may recommend you take medicine to help relieve any symptoms. You may have some blood in your urine for 2 to 3 days, which is normal. Risks. Complications are rare and more likely to occur when the stone is closer to the kidney. However, risks may include injury to the ureter due to perforation, which usually heals easily with no other complication, development of a urinary tract infection caused by bacteria, heavy bleeding and abdominal pain, and the occasional development of scar tissue within the ureter. Also, retreatment may be necessary in cases where stone fragmentation is incomplete due to stone size and anatomy, or if a urinary infection is encountered during the procedure. Other risks associated with surgery include the risk of anesthesia, deep vein thrombosis, blood clots that travel to the lungs called pulmonary emboli, cardiac arrhythmias, heart attacks, and stroke. The risk of death from a surgical procedure is extremely small. Typically, a patient will be given antibiotics to reduce the risk of infection. If complications occur and your symptoms do not go away, please let your physician know. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.